So after 4 months of treatment, she had reduced her alcohol use to just a few drinks a week, and she had started to open up to her best friend about what she had been dealing with. She also refreshed her resume and had started looking for new jobs to apply to. However, the nightmares were still very upsetting and disruptive to her sleep. And so since she had done well with written exposure, we agreed to try nightmare rehearsal treatment next. And that was the focus of treatment for the next 3 to 4 weeks. Basically, in nightmare rehearsal treatment, it's similar to other types of exposure. You have the person write the nightmare especially if they have a recurring nightmare, in as much detail as possible. And then you tell them that you want them to change one detail of the nightmare, just one, and then to rewrite the nightmare with that one detail changed, but really describing that detail in as much detail as possible. So when you look at traditional nightmare rehearsal treatment, what they'll generally suggest is that the detail be something that happens prior to whatever the really distressing thing is that happens in the nightmare. So, if it could be something easier if the person is having a nightmare that there's a monster coming after them or something like that, you can change the detail so that there's a door shut and the monster can't get in. But when you're working with nightmares that are about an actual traumatic event, it can feel invalidating if you try to encourage the person to change a detail that then negates the trauma that they actually experienced. That was the case with Deborah. She did have nightmares about the rape that she experienced in Afghanistan, and it didn't make sense to her to change the actual outcome because that's what happened to her. And in fact, she had a history of people not believing her. So what we talked about doing was trying to find something entirely separate from the trauma to change. And what she came up with was that as the person got close to her and was starting to be threatening, that it started to snow. And so obviously in the area of Afghanistan at the time that she was there, it was summer, there was no snow. And so that was an odd enough detail to write about. And she was able to write about it in quite some detail. And then you're supposed to read that account several times a day for the next week or several weeks. And she came back the next week and had done the homework. And what she reported was that she did actually start to see that it was starting to snow in the nightmare. And by having that awareness, it was enough to give her awareness that this wasn't actually happening again and that it was a dream. And so she was able to wake herself up. So we did this nightmare rehearsal for another 3 weeks, and the nightmares shifted a little bit. So we kept adjusting based on what was happening in the nightmares each week. But she reported a lot of relief from nightmare rehearsal. And it's a pretty cool thing to try with your clients. And there's more that you can read about as well. So we spent the final month of her treatment revisiting values and adding areas for her chosen committed action in order to get her life back on track.